A new health alert from international medical associations after several young patients have died or suffered severe reactions to general anesthesia. Anesthesiologists believe they've discovered an alarming link to patients of Venezuelan ancestry. And parents and young patients are increasingly being asked about their genetic history ahead of procedures. Fox 13's Kelly Cowan explains more.
This very much is an emerging issue, and doctors around the world are trying to study this as rapidly as they can while simultaneously sounding the alarm on what appears to be a genetic link between bad outcomes in anesthesia in otherwise perfectly healthy young patients. Now, last year, medical societies around the world discovered a genetic link between patients who were experiencing life-altering, sometimes fatal complications following routine general anesthesia. That link, a specific mitochondrial DNA mutation seen in some people with Venezuelan ancestry. And now more and more hospitals are working to screen patients and specifically asking about Venezuelan descent. Cases have been confirmed in the U.S., South America, and Europe.
We started to hear about patients that all of a sudden, without having any other medical issues, went for a general anesthetic for really elective procedures, and they did not wake up.
Our understanding is that there was a specific mutation in the mitochondrial DNA of a Venezuelan population, and with the globalization and immigration, and as these patients have since moved on to other countries and settled elsewhere.
The American Society of Anesthesiologists and the Society for Pediatric Anesthesia have issued a joint communication on the risk to young patients. But it comes at a time in the U.S. and abroad where tensions around geopolitical and domestic immigration policies are especially fraught. And that has led to some backlash, with many questioning why they're being asked to divulge genetic information and where and how that data may be used. Johns Hopkins All Children's tells me that this information is privileged, meaning it's protected by confidentiality laws, and that patients and their parents are not being asked about immigration status. While adverse reactions to anesthesia are rare, there have already been at least 2 pediatric deaths here in Florida that are linked to this specific genetic issue. So medical societies, physicians, and hospitals are trying to get the word out on this issue as quickly as they can to prevent future tragedies. For Fox 13, Kelly Cowan reporting.